Hey guys, I'm Dr. Mike and you're in the Pop University Lecture Hall, where today we're going to be talking about the science, the specifics, and the utilization of K-tape or kinesiotape for both the running and weightlifting athlete. A quick little intro, K-tape's been around for a while, being utilized by the athletic population since around the 1970s, with the goal of bringing this tape out to provide athletes with a sense of stability without restricting that movement. So the tape is meant to move with an athlete as they go through their range of motion. And we really appreciate the utilization of this because it's not just a tool that's utilized by clinicians in the rehab world, we actually see it used by athletes in the performance world and when they're doing a little bit of self-rehab on their own. So a great tool for us to use as performing athletes. The purpose of K-tape is simple, where it's going to follow 5 key components that are trying to be accomplished or that K-tape allows an athlete to experience. The first is going to be that of neurologic facilitation or inhibition. The idea that K-tape can stimulate or relax the specific muscles that are being addressed with the utilization of the tape. There's a pain modulation component that's going to reduce the amount of discomfort felt by an athlete by changing or modifying the sensation that is felt where the tape is utilized. There's an edema management component, which is this idea of the ability to decrease swelling, because K-tape causes a little bit of traction or pulling away of the skin, which opens up the lymphatic system to allow the body to flush and reduce inflammation or swelling quicker than on its own. There's a joint or a postural structural stability that occurs here, and it's the assessment or the assistance of the biomechanical components that allows the athlete to move without restricting their range of motion. And then lastly, there is a psychological effect as well. This concept that it provides athletes with a sense of security, allowing them to move through their movements, ranges of motions, and efforts with a little bit added blanket of security while they're performing those. The utilization of K-tape is going to fall into a couple categories, that being sports-specific injuries, overuse-related injuries, and then as well as a preventative utilization or model that is being applied not because an injury has occurred, but in the idea of preventing the future occurrence of this injury. Now, the effects of kinesiotape fall into 3 categories. There's going to be mechanical effects, there's going to be neurologic effects, and then there's going to be functional effects. The mechanical effects are all the stuff that we see picked up as it relates to clinical evidence. We see a microscopic lift of the skin away, which decreases the amount of pressure applied on pain receptors and can decrease the pain perception that an athlete is receiving. That same microscopic lift actually assists in improving blood circulation and in lymphatic drainage, bringing good blood flow in and pushing inflammatory factors out. It also provides a gentle or a subtle exoskeleton to assist with joint positioning. Neurologic effects are going to follow a little bit of a different pattern. It's going to affect what are called mechanoreceptors within the body, which alter the pain perception of an athlete. This is a specific term referred to as the gate control theory of pain, a stimulus provided from one thing masking or bringing less attention to a stimulus provided by another thing. As well as there's an increase in proprioception, and that's simply defined as the knowing of where the athlete's body is in space by the athlete. So knowing what my movements look like and how efficient my movements are by being able to feel them while I perform them. And then lastly, there are functional effects that are very common and appropriate and clinically recognized as it relates to K-tape. It's going to encourage a more efficient movement pattern. It's going to enhance confidence and performance as it relates to the utilized athlete. And then lastly, it can actually seem to be decreasing recovery time post-performance or post-exercise. Scientific evidence and clinical utilization is the next topic we want to discuss. As it relates to short-term utilization, we see really high levels of evidence affirming the utilization of K-tape for modulation of pain perception and proprioceptive cueing increase. Now, with further utilization, we see lesser and not as good evidence saying that there's not a huge correlation behind the utilization of K-tape and a long-term prevention of injury or a long-term increase in performance. So this is a tool that is very effective, but it's also a tool that we try to phase away from athletes as they get healthier and as they get stronger. In addition to that, we have found that the utilization of K-tape is not to be a standalone treatment. It's meant to be paired with other clinically backed research and treatment techniques, such as dry needling, instrument-assisted soft tissue mobilization, and other tools that healthcare providers can use to assist the athlete. Now, don't hear what I'm not saying. It is still appropriate if you are an athlete to use this for your benefit, but recognize that a lot of times this doesn't function as a standalone treatment, and you will need to implement some sort of soft tissue work or mobility or strength training to assist with your recovery and to get the true benefits of using K-tape. So in conclusion, I think we can come to a few agreements. One, K-tape is a really beneficial tool, not only used by clinicians, but also used by performing athletes. It has a lot of key benefits and components, including decreasing pain, increasing proprioceptive cueing or body awareness of the athlete, the ability to bring down swelling and speed up recovery post-activity or post-event, and then lastly, giving good feedback to the athlete as they use it. Now, the last component we do want to recognize, I've already keyed in on, is this is not a standalone treatment. So if you are working through some sort of an injury, there needs to be other stuff included here. And if you're using this as a preventative tool, the utilization of those other tools is also going to be beneficial in that of stretching, mobility, and strength training, or some sort of hands-on treatment like trigger point dry needling, or instrument-assisted soft tissue mobilization, or cupping, or something that fits into that category. These are the specifics on Kinesiotape and how they relate to our running and weightlifting athletes. Thanks so much for joining us today, guys.